The next item on the agenda is an update on emergency management in Ontario and the Provincial Nuclear Emergency Response Plan, better known as PNERP. This is presented by a representative from the Office of the Fire Marshal and Emergency Management, and I understand that Mr. Morton, you will start. I'm just reading what it says here. So over to you.
Thank you very much. Good morning. My name is Mike Morton. I'm Director of Emergency Management with the Office of the Fire Marshal and Emergency Management with Ontario's Ministry of Community Safety and Correctional Services. I am joined by Mr. Dave Nodwell. To my right, Dave is our Deputy Chief responsible for planning, and he has direct oversight of the Provincial Nuclear Emergency Response Plan. Also at the table with us this morning is Laurie Whitcomb. Laurie is our Senior Scientist. And in the audience, we have Mr. Jonathan Stone, who's our Manager of Planning, as well as Emma Fuchs, who is one of our Nuclear Planning Officers. I'd like to begin today by providing a general overview of emergency management in Ontario. This will provide some important context as we head into the Pickering and Bruce licensing hearings, and hopefully provide a good introduction for newer members of the Commission and for the public. Once I've spoken about that, I'm going to turn over to Dave, and he's going to take us through some of the general context related to the PNERP and the enhancements that we've made as a part of the new 2017 PNERP. Emergency management in Ontario is governed by the Emergency Management and Civil Protection Act. This act came into effect in 2003 following the ice storm of 1998 and the attacks of 9/11. The act was enhanced in 2006 following the SARS crisis and the North American blackout. Under the Act, authority is given to our office, the Office of the Fire Marshal and Emergency Management, to monitor, coordinate, and implement emergency management programs across the province. These take a variety of shapes. Primarily, we focus on municipal and provincial ministry programs. Each of our 444 municipalities in Ontario implements a mandatory emergency management program that consists of 13 program elements that are outlined in Ontario Regulation 380/04. Our ministries of government all have programs which require 14 mandatory elements, roughly mirroring the municipal programs with elements such as an emergency plan, risk assessment, emergency operations center, emergency information plan, and so on. The ministries also have an added responsibility to ensure the continuity of their critical government services and to develop and test annual plans to ensure that they can perform their emergency duties and deliver vital public services during outages or other disruptions that may occur. In addition, we have 13 ministries of the government that are allocated additional responsibilities under the Act. These are both functional responsibilities as well as hazard-specific responsibilities. For example, Ministry of the Environment and Climate Change would have responsibility for water quality emergencies. Those responsibilities are outlined in an annex to the presentation that's been provided. It is a time of great change in emergency management globally and also here within Ontario, and we're excited about a number of new initiatives that we have underway. And there's a number of factors that are driving these changes and affecting our current thinking on emergency management. One of the largest is climate change, and we're working on a whole of government effort with various ministry partners to respond and adapt to rapidly changing risk environment that is seeing an increase of natural hazard events, and in particular placing greater emphasis on flood events, which are occurring with a greater frequency and causing historic levels of damage in terms of cost and insured loss. We're also monitoring a number of new technological changes and working to incorporate those into emergency management. This involves everything from enhanced use of software to share information, GIS applications, UAVs, and even things like the current advancement toward wireless public alerting, which comes into effect this Friday. More generally, the lessons of major disasters of the last decade have placed a greater emphasis on ensuring that emergency programs are in place for vulnerable populations and placing a greater emphasis on community resiliency. For example, Hurricane Sandy in the United States that affected cities such as New York showed the importance of inclusivity in emergency management and emergency planning and an ability to proactively reach out to all residents of major urban areas, particularly that those may have special needs or disabilities. So for us in Ontario, that's increasing focus of importance, while also looking at whole communities that we feel historically have been underserved by emergency management programs. And in Ontario, that would include our First Nation communities. So we are working closely with Indigenous Services Canada, as well as the Chiefs of Ontario, to look at ways in which we can support the development of equitable emergency management programming for First Nation communities in Ontario. Very closely related to this is an increasing focus on relief and early recovery activities. So developing our programs in areas that go beyond that immediate life-saving phase that is typically thought of when we think of emergency management. We think of rescues, people being taken out of floodwaters, immediate evacuations. We're placing a greater emphasis on what comes immediately next and how do you ultimately restore communities. And this is an effort that engages partners that are not necessarily what we think of as our traditional partners in the emergency services who play those vital life-saving roles, but also members of the broader community as we shift toward more of a whole-of-society approach to emergency management that focuses increasingly on social services, public works, the not-for-profit sector, faith-based organizations, and so on. So ultimately a much more inclusive model that is consistent with another driver of our thinking at this time, and that's value of money. Looking at how we can measure the impact of program investments on emergency management, which is increasingly focused on prevention and mitigation activities as an international trend that we're seeing and very much playing out here in Ontario to ensure that maximum value is achieved from each dollar that's invested in emergency management. So very closely related to that, and as members may be familiar with, a number of recent public reports that have assessed emergency management in Ontario. The first one that's represented on the slide here is the Auditor General's Value for Money audit that was delivered just this past December and made 13 recommendations about our program here in Ontario, while also reiterating a lot of the progress that has been made under the Emergency Management Civil Protection Act since the ice storm and 9/11. We also commissioned an independent third-party report, our Emergency Management Review, which was delivered in a similar timeline late in 2017. That, along with the Auditor General's report, are posted on our website and can be viewed by the public at ontario.ca. Three other reports that are contributing to our forward direction on emergency management, both generally and help influence us on our PNERP, include our ice storm of 2013 after action report, which again focused a lot on the ability to deliver assistance to urban populations and vulnerable populations, our report of the Commission of Inquiry for the Elliott Lake Mall collapse, and our study on supply chain management, which was also in follow-up to the ice storm and recommended a number of enhancements for improving our capacity to deliver aid on a large scale. These reports have highly influenced our strategic framework for the next years here in Ontario. And on the screen, you see a quick summary of what we're calling the Emergency Management Action Plan, or the EMAP. It has 5 major goals. It was announced by the government late in 2017. And this action plan takes measures to address all of the recommendations of the Auditor General's report, of the independent third-party review, as well as the 3 other reports that I referenced on the previous slide. So over the next years, we are taking action, and the government has committed to measures that will address, again, all of the recommendations of those reports on a very aggressive timeline. The 5 major themes that you see up there cover a variety of aspects of our program, and I won't get into all of the particular bullets as, again, the presentation is posted publicly, but you see some of the themes there, which include a strengthening of our governance and oversight, and just recently our deputy ministers from across the government met, as did our Cabinet Committee on Emergency Management, and one of the measures out of those meetings was enhancements to our internal program governance, which will involve a Deputy Minister's Committee on Emergency Management to ensure interministerial cooperation, as well as some new working committees at the ADM and directors levels. A significant part of the action plan is also a commitment to review the Emergency Management and Civil Protection Act fully, and that process will be kicking off soon. And we will be on the third list of items there. You see that we'll be updating all of our major provincial plans, and this work is already underway. Both our provincial emergency response plan as well as our provincial nuclear plan, which Dave will be speaking about in just a moment. We're also taking a number of measures under the 4th and 5th goals to enhance our capacity to respond to large-scale events, including the procurement and deployment of emergency management software across all ministries and municipalities with Ontario, and significant enhancements to our supply chain and logistics system. Some additional measures that we're doing under our business plan are listed on slide number 8. And again, I won't go through all of these as you have the presentation, but I will draw attention to just a couple. The second bullet speaks to new provincial exercise strategy and program. The development of that is well underway, and we'd be happy to speak more to that at any time, but essentially creating a multi-year outlook for our exercise activities, including our nuclear exercise activities, and ensuring that our programs are based on assessing improvements that have been made. So rather than repeatedly identifying the same issues or areas of improvement for our various plans, including the PNERP, and then constantly testing those and just reaffirming that they're still not fixed, we want to get into a good cycle of identifying corrective actions, having a clear plan to address those, and when we feel they've been addressed, testing that element based on the corrections that have been made, and only putting in the effort to test that once those corrections have been made. So really a complete continuous improvement cycle. And again, we can speak a little bit more to that if members of the Commission have questions about that. I think at this point, what I will do is turn over to Dave. He's going to begin by talking about off-site nuclear emergency response in Ontario in general, and then he'll get into some very particular enhancements that have been made to the PNERP. So Dave, over to you.
Good morning. Dave Nodwell for the record. We have a fair number of slides here. I think in the interest of time, I'll move through them reasonably quickly so that there's time for questions and engagement. For the benefit of new Commission members, I'd like to provide a little bit of context in terms of nuclear planning. Mr. Morton already spoke to the Emergency Management and Civil Protection Act. And key within that act is Section 8, which is a requirement for a plan for nuclear and radiological emergencies. It's the one hazard that is, in fact, identified in the particular act. It's particularly important to understand that in terms of the role of the province, we're dealing with the off-site consequences to ionizing radiation that goes beyond the fence line at one of these facilities. So the on-site response is the responsibility of the facility with the oversight of this Commission. The province is the authority having jurisdiction beyond the fence and dealing with those potential consequences. These responsibilities are executed in concert with a number of organizations. This is a very multi-jurisdictional response that includes the facility itself, municipalities, provincial ministries, and federal departments supporting. So it's a all-of-government, if you will, response, and that goes into the planning process. The master plan itself describes the general roles and responsibilities for the response to a nuclear or a radiological emergency. in Ontario. Underneath the master plan are a number of site-specific, largely implementing plans which operationalize what is laid out in the master plan. All major organizations that are involved, municipalities, the NPPs themselves and so forth, are involved in developing their own plans that are consistent with the requirements of the PNURP and as laid out in the PNURP. We do have a committee comprised of all of the response organizations that meets on a regular basis, approximately 3 times a year. It's called the Nuclear Emergency Management Coordinating Committee. And we come together to enhance nuclear planning in the province, working on the plans themselves and the operationalization of those plans. In the event of an actual response, the facility that is primarily involved in directing the response is the Provincial Emergency Operations Centre, located in Toronto. As I mentioned the last time I was here, we'd be pleased to offer a tour of the PEOC to any commission members who would be interested in seeing that facility. It's a very effective facility and one that we're very proud of. We also regularly, and we'll speak more to this, participate regularly in nuclear drills and exercises. We've been under a major initiative recently, in particular to get the master plan updated, and this was done and approved in December of 2017 after an extensive public consultation and input from all of the organizations with named responsibilities in the plan. The public consultation was carried out, and in fact was the first time that we had done this with the PNURP. And to deal with the disposition of those comments that were collected during the consultation period, an advisory group was formed and comprised of national as well as international experts to assess the comments and provide recommendations to the minister. These recommendations, along with a number of other things, were incorporated into the new PNURP master plan, and in a nutshell, make the plans much more transparent and accountable, increased alignment with national and international standards, so specifically the CSA N1600 standard, as well as the IAEA GSR Part 7. A very quick overview of the public consultation process. There were 2 documents posted. One was the planning basis discussion paper, which talked about the planning basis for the plan, as well as a list of the proposed changes to the plan. Those were posted for a period from May 15th, 2017 to July 28th. It was a longer than normal public consultation due to requests from interveners who required more time to digest the information and provide their information to us. We received during that period of time approximately 1,600 submissions, nine municipalities and federal government stakeholders. There were 33 individual different organizations and 1,526, to be precise, individuals, of which there were 440 unique comments, with over 1,000 submissions from 2 separate letter writing campaigns. So I mentioned the advisory group was appointed by the minister to review these comments and provide recommendations on the incorporation of the public feedback into the master plan. This advisory group met in Toronto towards the end of August, and they conducted in-person consultations with a number of interveners and spent the balance of the week in terms of deliberations and the formulation of the report. In the report itself, and I'll go through this fairly quickly, but there were 15 major recommendations. In general lines, providing for more robust justification and clarification of the rationale, the principles, and the assumptions that go behind the plan, to conduct more detailed and definitive technical assessments for future iterations. And I'll be speaking in more detail in terms of that technical assessment, which is under development right now. It encouraged implementing more formal procedures around the regular review of the PNERP with additional requirements for transparency and public engagement. So that is now a formalized process of the PNERP review. Clearly communicating linkages between the PNERP and other plans that we have in place was a recommendation as well. Some other results of the advisory group report. They found that the assessments that were used in the planning basis discussion paper were very highly sensitive to radiological source term selection and of limited scope. So they have actually made the recommendation that we do move forward with a more detailed technical assessment, which is underway. Despite some of the limitations that they found with this particular work, they found that the existing planning zone sizes are appropriate for a single unit unmitigated accident, as well as multi-unit events where some of the post-Fukushima improvements have been credited in the source term calculation. They found that the planning zone sizes may require revision if the basis includes a multi-unit failure where none of those post-Fukushima improvements or mitigating actions have been credited. The technical study, and as I mentioned, we're just underway with that process, has a number of objectives. One being to assess the potential impacts of weather and topographical features on dose projection modeling. So this would be more enhanced meteorological data over a period of 1 year. It would also take a look at local topographical and meteorological conditions that may be caused by local features. And this was one of the recommendations that came out of one of the interveners from the Bruce area in particular, where they have thermal inversions, which they wanted to see incorporated into the analysis. Would identify any requirement to expand protective measures, including KI pre-distribution. So the KI component is a formal part of the technical study. This study will be completed by the end of this calendar year, 2018, and we would at that time, based on the results of this analysis, propose options for revisions to the PNERP or implementing plans to our minister as a result of that study. The master plan updates, there are quite a few updates to the plan. I'll run through at a very high level what those changes are at this point. There are new administrative requirements in Section 1.3 with a formal 5-year plan review cycle. And this is the intent to uphold the province's commitment to transparency and accountability. So in that section, the PNERP requires consultations with the stakeholders who are involved, but also the public. So we'll be going through that public consultation on a regular basis. Any review of protective action strategies or modifications would be done in consultation with designated municipalities and other impacted municipalities. The master plan was aligned with national guidance. I referenced CSA N1600 earlier, as well as GSR Part 7, aligned with both of those documents, and also aligned with Health Canada operational intervention levels. So we've brought the plan into alignment with the recommendations from Health Canada. Updated descriptions on planning basis, accident scenarios, and severe accidents, so more detail about what kind of an accident are we looking at. Of major change is the addition of a contingency planning zone, and this is a new zone 10 to 20 kilometers from the reactor facility, and I'll be speaking in more detail around that contingency planning zone. Concept of operations section has been enhanced in the plan, as well as improved ease of use and terminology. There are new program management requirements built into the plan, such things as defining, documenting training requirements, the development and documentation of exercise program requirements, more detailed descriptions around emergency phases and the transition to recovery. There's a new section on the management of radioactive waste based on national and international guidance, as well as a new annex with the detailed rationale behind the planning basis, including planning zone sizes. So more information on that in the master plan. The names of the zones have changed. Those who have been around will remember the primary zone, the secondary zone, and so forth. We brought these names in line with the terminology from CSA N1600. So the 3 kilometer zone immediately surrounding the reactor facility is now referred to as the automatic action zone, which is descriptive of what happens in that particular area. What was the 10 kilometer primary zone is now the detailed planning zone. So that's the area where detailed planning is required, where you would anticipate, for example, the need for evacuations in a very severe accident. I mentioned the contingency planning zone. So this extends out to 20 kilometers. And is an area where contingency planning and arrangements would be made in advance so that protective actions can be extended beyond the detailed planning zone. We've often spoke about the flexibility of the PNERP and our ability to implement protective actions beyond the nominal 10 kilometer area. This articulates how the province would go about doing exactly that. And then finally, out to 50 kilometers, which was the secondary zone, we now refer to as the ingestion planning zone. So again, descriptive in terms of what is actually conducted in that area. A bit more on the contingency planning zone. So it is intended to be used where required in a severe, low probability accident, which could result in consequences beyond the detailed planning zone. It doesn't require the same level or type of detailed arrangements that you'd find in the automatic action zone or the detailed planning zone. Response activities within that area may occur in the event of localized radiological releases or contamination. So dealing with the typical hot spots or something like that might occur beyond the 10 kilometers. There is greater clarity, which has been set out in a specific annex of the implementing plans for Pickering and Bruce that talks about this zone in more detail. It requires that municipalities look at all of their response centers that may fall within the CPZ and a development of possible alternatives outside of the CPZ. So if there was to be if there was the potential of contamination at an emergency worker center or an emergency operations center within 20 kilometers, that they would have pre-identified facilities that they could move their location to. Iodine thyroid blocking requirements are consistent of those with the ingestion planning zone. There are public awareness and education requirements out to 50 kilometers that are a part of this. No requirement for the designation of additional emergency response centers, and no additional public alerting or communication requirements beyond what's already established for the detailed planning zone. I would point out that we would be using provincial resources for public notification and public alerting, and we have new systems coming into place effective this Friday, which will make that very, very useful to us. There are requirements that appropriate funding be put in place and administrative oversight. And as is identified in the master plan, reactor facilities are required to assist the province and designated municipalities in their planning and preparedness for a nuclear emergency, which is an ongoing relationship that we have with the facilities. Protection of emergency workers, Annex H has been revised to reflect Canadian guidelines from Health Canada for emergency workers. There is transportation management and evacuation planning. This has been modified to a unified transportation coordination center, and basically modeling on the provincial experience with the Pan Am Games, which will be brought to bear in the PNERP. Coordination of emergency information, we have moved some of this back to a joint information center where those entities that would be dealing with the public, municipalities, the facility, the province and federal agencies, which would be able to actually physically meet in a joint information center to coordinate public messaging that goes out and so forth. So this is actually going back to previous iterations of the PNERP incorporating this particular aspect. With respect to KI pills, the new PNERP uses Health Canada guidance of a 50 millisievert intervention level. We're maintaining pre-distribution within the detailed planning zone, so to a nominal level of 10 kilometers. But it is also available to anyone who wants it within 50 kilometers from a nuclear power plant. This process meets the current Reg Doc 210.1 from CNSC. A new section providing more clarity around the care and protection of animals, in particular dealing with livestock and the role of the PEOC and the Ministry of Agriculture, Food and Rural Affairs. New requirement for municipalities to document their emergency response organization training plan and exercise program. Additional requirements for designated municipalities, for example, ensuring that all municipal personnel assigned functions under the plans are suitably trained for their tasks and so forth. So there's significantly more guidance in terms of training and exercises. Protective actions, I think really what I'd like to point out here is that it is the Provincial Chief Medical Officer of Health that makes the decision regarding KI ingestion. The master plan has introduced actual three phases in which protective actions would be considered. So we have early, intermediate, and recovery. So there's more guidance specifically related to the implementation of protective actions at those stages. So next step and next steps. And there is certainly a lot on the go. Evacuation planning is a big part of that. Ministry of Transportation is the lead and are updating traffic control plans and putting them into the Unified Transportation Management Plan, which I spoke to a few minutes ago. This is a subcommittee of the Nuclear Emergency Management Coordinating Committee, so reports to that committee in terms of their activities. In the interim, existing joint traffic control plans would be utilized while that work is being done. Recovery phase planning has been identified as a next step and is planned for development with the participation of any MCC participation and aligning it with Health Canada and CNSC framework document on recovery, which I know has gone out for public consultation, is being reviewed. This may form a separate plan or perhaps as an annex to the PNR, but it's clear that recovery planning is something that needs to be documented and articulated. There is a lot of work going on with the Environmental Radiation and Assurance Monitoring Group, or the ERAMG, a bit of a mouthful for an acronym, but it works for us. This plan essentially represents what's being coordinated out of the science section in the Provincial Emergency Operations Center. And is under significant review in terms of a concept of operation for all of those POC-based roles, as well as the field teams who are going out and doing the actual monitoring. This is a very detailed plan. It's currently being reviewed by stakeholders. It aligns with the revised PNRP, but also aligns with CSA and 1600 and a number of standards from the IEA. As this plan is formalized, planning is underway for a workshop and a tabletop exercise that will test and validate the new concept of operations for that group. Supporting plans will be an important next step. As the master plan has been completed, implementing plans become completed. It is time that ministries and municipalities bring their own plans into alignment with the changes made in the PNRP. That would be a process that would take approximately 12 months. And will be underway very shortly. In the interim, existing implementing plans would be utilized. Where there is a conflict with the 2017 master plan, the latter would take precedent as much as possible. And some other related initiatives. OFMEM is conducting PNRP information sessions for municipal stakeholders. This has been going on now for approximately 2 months, 2.5 months perhaps. And we've been meeting at the municipal level with various councils and at the staff level as well, in the area of Bruce and Amherstburg, as well as Durham Region and Toronto. So those have been very good sessions to inform staff and elected officials in terms of the new master plan and what it looks like. There has likely been discussion that we are participating in an emergency preparedness review or an EPREV being conducted by the International Atomic Energy Agency, and that is being scheduled for June of 2019. So we're in the preparatory phase of getting ready for the EPREV. We have ongoing nuclear drills and exercises. The most recent or the next full-scale exercise would be associated with Bruce Power in October of 2019, and we're just in the initial stages of discussion with Bruce on that particular point. We will have ongoing updates to the balance of the PNERP implementing plans. As I mentioned, we have a total of 7 implementing plans which we will be working on, and ongoing review and alignment to all of our nuclear procedures and emergency bulletins. And that concludes my presentation. My apologies if we went a little bit over what had been scheduled.
Thank you.